right, we're going to begin this hour with a look at the steady rise in long-term coronavirus cases in this country. It is estimated nearly 1 in 5 Americans who have been infected have so-called long COVID. That is when symptoms last 3 months or longer. Dr. Jon LaPook reported on research to diagnose and treat long COVID and the struggles patients face. He did that for CBS Sunday Morning. Take a look.
It's very isolating. You feel like you're disconnected to the world. The world is moving on without you, and you kind of feel invisible.
That's a terrible feeling.
It is.
Ken Todd works for CBS's parent company, Paramount Global. But we met him through Survivor Corps, a long COVID patient support organization. Todd used to be a CrossFit fanatic, but a month after contracting COVID, he found even a stroll in the park would exhaust him.
Were you short of breath at all?
I was not short of breath.
No chest pains?
Nope, just a weird feeling. I went home and I slept for probably a couple of hours and then felt better. But that was really the beginning of realizing that something different is going on here.
Morning. How are you?
What's been going on are the unresolved and to outside appearances largely invisible consequences of COVID-19. For Ken Todd, that means fatigue, dizziness, inability to regulate his body temperature, and difficulty concentrating. Those are among the most typical symptoms, though chest pain, palpitations, and shortness of breath are also commonly reported.
Can you diagnose long COVID on a blood test?
No.
X-ray?
Nope.
CAT scan?
Nope.
MRI?
Nope.
Brain scan?
Nope.
Physical exam?
Nope.
So you can imagine how that would be disconcerting to somebody who has some symptoms.
Yes, indeed. The scientific community needs to quickly understand what's going on and needs to quickly make some criteria, some diagnostic rules.
Here at NYU Langone Health, where I'm a professor of medicine, Dr. Leora Horwitz has gone from treating patients during the worst of the pandemic to searching for a way to diagnose and treat long COVID. Dr. Horwitz is helping to guide a $1 billion study run by the National Institutes of Health. It's called Recover, and its goal is to learn why so many people who contract COVID-19 are reporting long-term symptoms.
I've been in research for 25 years. I have never seen a study of this scale and this scope start in such a short amount of time.
And Dr. Jon LaPook joins us now. Jon, good morning. Good to see you. So what did you learn about the NIH study and the time frame to get some answers?
Yeah, they're ramping out pretty quickly. They got about a third of the way there in terms of adults getting to about 18,000. They're a third of the way there. But Dr. Horwitz, you just saw, said that we can help the study because there's underrepresentation in certain communities. People who are Hispanic, come from rural communities, who are currently infected, never infected, or were pregnant during COVID, and they want children of all ages, no matter what their COVID status is. So it's something that we can do to help this study go along. You go to recovercovid.org. You can sign up.
Oh, that'd be great. Dr. LaPook, we're in this new wave, whatever number it is of COVID. I know multiple people, we all do, that have COVID right now. Are people less likely to get long COVID if they're getting COVID right now because maybe they might be vaccinated or we're better able to treat it?
Yeah, that's one of the things we're trying to tease out. They're trying to tease out. It does turn out that if you were vaccinated, you do lower the risk of getting long COVID. But these kind of questions about what are the risks and who are the populations who get it and what to do about it, these are all things that we're trying to figure out with these long-term studies.
If you suffer from long COVID, you test negative if given a PCR test.
Correct.
But you have symptoms that are not explained any other way.
Right.
So how do you diagnose it? You went through that list, and
yes.
It seemed like...
It is so frustrating for people because they feel lousy, and some people really are debilitated. But there's no specific blood test, there's no brain scan, there's no CAT scan, there's nothing on physical exam that specifically says you have long COVID. And that's one of the things they're trying to look for, biomarkers, maybe do some sort of blood test that can figure it out, or even cerebrospinal fluid. But there are all these theories about why people have it. I mean, there are 4 ones that we mentioned in the piece.
How do they then screen people for this big study then to make sure that it's self-identified long COVID sufferers?
Yeah, there are symptoms. I mean, there are dozens and dozens and dozens. And one person said, there are like 200 symptoms, and how are you supposed to figure it out?
And how are you supposed to treat it?
And
if
how
you
are you
have a
supposed to treat
symptom
it?
that you lost your sense of taste, for example, or you're out of breath when you go for a walk, how do you treat that?
Yeah, so 2 questions. One is, how do you diagnose it, and how do you recruit people people. And one of the things is, people know they're just feeling lousy, more than a month after. And they come in and they say, let's try to tease this out. Maybe it's something else. Maybe it is this. In terms of treatment, two of the theories are that your immune system is overactive. So the virus is gone, right? But your body doesn't realize it's gone. Or maybe your body is mistaking there's something similar between the virus and something that's part of your own body. And it's attacking it yourself. It's like an autoimmune thing. So maybe you could do something to try to decrease the immune response. The other thing that I think is fascinating is there is evidence that there are remnants of the virus in some people. It can be found shed in stool months after the virus is, supposedly you're over the initial episode of COVID. So that's fascinating. That's in a certain subpopulation of people. But if that's true, then maybe giving something like Paxlovid or another antiviral to try to flush it out later could be something. None of that has been tried yet. These are all theories. They're going to have to do a lot of trials to see, okay, how do we identify it? How do we say which is the subpopulation of people who get this treatment or that treatment? It's not going to be one size fits all. I'm sure it's going to be different types of treatments.
It's not going to be one report fits all either. I'm sure you'll be back on this
You'll
subject.
ask me back?
Yes, you'll be back.
Thank you.
You got the job.
Dr. Jon LaPook, thank you very much.